being in a rural area, um, not only is medical care where we need to partner with our community healthcare partners, but it's in almost all the healthcare services that we provide. I'll give you some examples. Suicide prevention is huge. I mean, that's been a high priority, one of the top priorities, veteran suicide prevention in the VA for many years now. We've been successful. It's been coming down from 22 to 20 to, I think the most recent was lower than 20. But so suicide prevention and how we have to partner with the communities there as well in getting the word out. We've kind of an initiative that we had here in Iron Mountain that we've kind of spread to other medical centers is our Veteran Crisis Line Label campaign, where we partner with community businesses. Now we've done, which, for example, sending, putting labels that we provide, and actually we tell like the local coffee shops in Marquette, for example, Big B Coffee, and then there's Lake Superior Pizza, there in Marquette, Congress Pizza, on their cups or on their boxes. Now for like some of the coffee shops, like local here, we're able to get them. We get our volunteers to put the labels on the Holiday Station cups, the local here in Iron Mountain, Edelweiss coffee cups. And then when you get a coffee in the morning, there's going to be a VA label on there with the Veterans Crisis Line with a message saying, if you have a loved one, or if you or your loved one's in crisis, a veteran, we have a Veterans Crisis Line and the number to call. We've done that now in 24 of the 25 counties that we serve. Also, we work with other groups such as Upsale, for veteran-specific events. And again, getting the word out, we provide suicide prevention training to community groups. So we call it SAVE training. So we work with the community on that. Another program is our Homeless Veterans Program. Up here in the UP, homeless veterans, it's not the same as a metropolitan. You don't necessarily see them on the street, but they may be couch surfing. They may be in a more local shelter, temporary shelter. But we work with Great Lakes Recovery for emergency housing needs. Again, in Wisconsin, the Veterans Outreach Recovery Program. So, we again work with, our community partners there in reaching out to homeless veterans and then also caring for homeless veterans. One thing I forgot to mention on the medical side is we have 7 contracted nursing homes throughout the 25 counties. And what that does is, we have one nursing home here, a community living center. But if you think of someone in, that's farther away, it's hard for their families to come and always visit. So we do have contracted nursing homes, local community nursing homes, but they have to meet very high, the high government, standards that we have here. So we partner with those. Also vocational rehabilitation programs. That's where we help veterans who may struggle getting jobs for various reasons, maybe healthcare related, and we help them. We teach them resume writing. We teach them some skills, and then we partner with local business communities for doing supportive employment type of thing. So hiring veterans that have been through the program, and they do are very good workers. So here at the VA, we hire them, and they actually progress and they get promoted. So it's a program that we have here, but we do work with our community business partners on that. And we have our Veterans Justice Outreach Program. The veterans that may get in trouble with the law, but it could be related to their time in combat, could be PTSD related. And so we have a Veterans Justice Outreach staff, and they work with the local courts and to put in programs that if it's a veteran, it's a first-time event, that we have other programs. We can get them into VA healthcare if they're not in VA healthcare. Maybe able to get into mental health care if needed, or substance abuse programs through the VA. So we have a lot of different programs that reach in and reach out to the community for helping us to serve our veterans.